All right, so what we're going to be spending today talking about is colon health and colorectal cancer. And this is incredibly important as we're going to discuss, because colon cancer is actually the second leading cause of cancer deaths in the United States amongst men and women. I mean, is that shocking to anybody here? Right? I mean, if we think about the different types of cancer, whether it be breast, lung, bone, brain, I mean, we could go on and on and on, but colon is the second leading cause of cancer deaths in the United States, all right? And much of that is due to screening. 60% of it can actually be prevented through effective screening. And that's why we're really focusing on that through our discussion today and throughout the month of March. And so hopefully you'll be able to take pieces of this information home with you to educate your friends, your family, your community, because this is one area of cancer kind of research and medicine that we can really have a huge impact on through preventative screenings. So with that being said, I always provide a general overview of what we're going to be talking about. We are going to be just talking about some basic facts about the colon, colorectal cancer facts, diagnosis, and then coping with this. Again, because this is a very prevalent diagnosis, many people have it, we really need to focus on ways in which we can help to manage this condition, okay? All right, what is the colon, right? I mean, we don't think about that until maybe we're at the point in time in which we're starting to get screened, or whenever we notice we have some problems. So basically the colon is known as a large bowel or large intestine, and it's an organ that is a part of and very important to the whole digestive system and tract, okay? Does anyone happen to know how big it is or how long? 5 feet. 5 feet, yeah.
I know they can take a foot of it and you still got plenty.
Isn't that something? On average, I think it's about 5 feet in most humans. So, I mean, I'm about 5 foot 5 inches tall. It's like, where is all that at in here, right? But just think about that. Those 5 feet are so important, and it's actually, you know, kind of segmented into different sections. But it is key whenever we're talking about digestion and how our body processes foods and absorbs nutrients. The foods that we eat are very important to the colon. And the types of food that we eat are actually really important whenever we're talking about its health in general. So whenever we're looking at the types of foods that we might be enjoying at our free lunch and learn here, it's the best kind of meal plan or nutritional kind of makeup that we want to be thinking about is a low calorie, high fiber with lots of water. And just in terms of our digestive system in general, water is one of the key things that we need to be consuming on a daily basis, because it does help so much with our digestive processes, okay? Not pop, not necessarily soda, okay? Water, actually. Our colon can absorb a quart of water a day. And it does that because it helps to keep things moving. And so if we're not drinking a whole lot of water a day, not only is our digestive tract likely to get kind of upset with us, but that can also cause a whole lot of other problems and deficits throughout our body as well. So we really, really want to be very mindful of the types of foods that we are consuming and the fact that it does play an important role in our colon. All right, how is the colon affected by stress? As a clinical and health psychologist, I see a lot of patients that have different medical conditions. One that I specialize in a whole lot is diabetes, but also in IBS. I receive a whole lot of referrals from one of our physicians here, Dr. Ha, because so many people have IBS, and stress is the #1 predictor of exacerbations from IBS. Okay? Makes sense in some ways, doesn't it? If we think about the way that our culture often describes stress, where does it tend to live a lot of times? We get butterflies in our stomach, right? Okay? We talk about our gut kind of hurting and aching a lot of times whenever we get sick. And so it really does tend to absorb a lot more than just food, okay? Our stress from different situations, from thoughts, from people, not just stays external. Our body does kind of have an impact to it. Many studies have shown this. and this is just a few just to kind of highlight it. Psychological stress can have a marked impact on intestinal sensitivity and motility, and this is its ability to move, okay, to kind of process food and to metabolize things. It affects our immune system and the gut-brain interactions, which change the body's gastrointestinal responses. Okay, so whatever's happening here and here are talking to each other. So if we're stressed out and worried about things, then all of those thoughts, all of those kind of experiences don't just stay up here. They essentially travel down here and cause a massive disruption to our system. Okay? If you think about that, you can imagine times in which you've been stressed out yourself, experienced some unexpected bad news, and all of a sudden your stomach starts to change or it starts to get very sick. This is why it's this whole brain-gut kind of connection that takes place. 40 to 60% of those diagnosed with IBS have also been found to have comorbid diagnosis of depression and anxiety. Again, that's a high comorbidity rate whenever we're looking at chronic diseases. Stress has also been found to affect GERD, very common, especially in primary care practices, IBS, irritable bowel disease, and just quality of life in general. Okay, so these are some big things that we want to kind of keep in mind, is that stress does have this effect on us. One thing I forgot to mention is the immune system. Okay, how does this work whenever we're talking about the colon and our digestive system? Our belly has all those good bugs down in it, right? And their job primarily is to help us to digest things, but also to help to fight illness, right? To help to have an immune response to it. And anytime that we're getting stressed out, that is destroying those kind of good bacteria, or making it harder on them to function, because it's a lot of times attacking an imaginary stressor that's not there within the body, but that's putting a lot of tax on that system, and then it's making that environment unhospitable as well. And so we've really got a lot of different interconnections that happen with this, and so we want to be very mindful of it. So those are some basics just about the colon and its health, with really the key points kind of being paying attention to what we're eating, what we're drinking, and what our stress level is, okay? Now, colorectal cancer. That's hard to say. Try saying that like 3 times fast, and it's a tongue twister, right? But it is so important that we're recognizing this, as I mentioned earlier, because of the fact it is the second leading cause of cancer deaths. I mean, that's just, again, staggering if we think about this. 1 in 20 people will be diagnosed with colorectal cancer. 1 in 3 are not up to date with screenings. And so if we've got, just as examples, 3 people sitting at this table, 3 people sitting at this table, odds are 1 of us is not up to date on what our screenings are and what they kind of need to be. And that's significant, again, because 60% of colorectal cancer deaths can be prevented with screening. With effective screening, 60% could be prevented. That's a staggering statistics whenever it comes to cancer prevention, and it is all due to screening, all right? Few other kind of notes on this. Although the incidence of new colorectal cancer in adults over 50 has declined, there has been a rather rapid increase in new diagnosis under 50. And this is where the research is starting to kind of look at and turn, and even where I would expect some of our clinical guidelines to start to change, right? Because most of the time we're not paying attention to the colon until around 45, 50 years old, unless there's a problem. But we have seen diagnosis of colorectal cancer in the 30s, okay? I've seen several patients who have been diagnosed at 30, 35, and 28. So, again, something to be mindful of whenever we're talking about this. As I even mentioned that statistic, some of you were shaking and nodding your heads as though you had come in contact with people who had been diagnosed with colorectal cancer under the age of 50. So, big area of emphasis that we're continuing to look at, but that just continues to point to the fact that if you're noticing any abnormal signs or symptoms about your body, the best thing that you can do is schedule that appointment with your primary care provider. Spend a lot of time kind of talking with them about what your concerns are, So that way you can get the appropriate screening and then referral to treatment. Okay. Whenever we are talking about diagnosis, I don't know that there's another diagnosis that kind of has that fear to it as what cancer does, right? Almost as soon as you hear that C word, fear is the automatic response that follows it, right? And so many of you, again, are shaking your heads and nodding with this. And this is where screening and staging is really, really important. Age can be a significant factor in predicting a person's coping with cancer long term. Adjustment disorders, depression, cancer-related PTSD are all things that we see as happening whenever someone is diagnosed, okay? Now, whenever we're talking about screenings, what are some of the screenings that you guys may be familiar with that we use for colon cancer?
Colonoscopy.
Right, okay. Does anyone like the idea or sound of that? No. That often serves as one of the biggest barriers to screening, is that people do not want to go through that entire process of having a colonoscopy, right? However, there are other screening methods that can be used. Does anybody know of it?
One of them's that pill.
Okay. One that you can do in the comfort of your own home, which is better than coming into a doctor's office, right, is a fecal occult blood test. All right. This is an oftentimes first-line screener for colon cancer that you can do in your home.
Just go.
just go. That's exactly right. That's the saying with it. All you got to do is go and then send that little card back with your sample in, right? And that's it. So just think about that. We don't have to jump straight to a colonoscopy sometimes. Now, if there's a lot of other clinical indicators, if there's a lot of other problems that a person is experiencing, then your physician may want to take that path with you. But generally speaking, a fecal occult blood test can often serve as the first line of screening that can help in terms of being preventative as well as diagnostic with this. Then that could lead to a colonoscopy or other procedures from that. Done in the comforts of your own home. You don't have to prep for it. You don't have to drink any juices. You don't have to come into a doctor's office for it. You just need to talk with your primary care provider about it or your GI doctor about it, and they can get you hooked up with that test and assessment. Yeah?
Is there some kind of a kit that you...
Essentially, basically it's kind of like a little card that you have to put a specimen on, and then, it has a nice way of, in a very sanitary manner, shipping things back out, but essentially your doctor's office lab gets it, is able to process it, and then your doctor's informed of what the results are, and from that, you're able to then determine your next line of treatment.
So where do we get the kit?
You need to have the appointment with your primary care doctor, with your GI doctor. Let them know that you are wanting to be screened for colorectal cancer because of risk factors. Maybe it's because of your age, your gender, some problems that you may be experiencing with your digestive tract or going to the restroom, and then they can get you set up to have that screening done. So real quick, real simple, easy peasy, and then you don't have to worry about, jumping straight into that whole stigma of having a colonoscopy again. That may be needed, but just as a first line of screener, that's often an option for most people, okay? So remember that can be very helpful in this. And going back to talking about cancer, one thing that we know is that when we're talking about age, folks who are diagnosed with it younger tend to have a more difficult time in processing the diagnosis of cancer, okay? And we can attribute that to the different life changes, the type of treatment that may be utilized and how that may affect their goals, right? Whether that be educationally, whether that be in terms of pregnancy, starting a family, financially, and then the long-term kind of progression of being a cancer survivor. Because once you've experienced the diagnosis of cancer once, there's generally that ongoing fear that continues to happen of remission, okay? So imagine that happening at a younger age and then carrying that on with you throughout the course of your life, okay? So that's what we're looking to in terms of that attribution there. Now, with these other types of kind of conditions or things just to be aware of, adjustment disorders. These are related to a life stressor, anything, that then results in multiple changes occurring from it, Okay, so an easy way to kind of think of this as is that something pretty tragic, very uprooting happens within our life, and it's kind of like the pebble being thrown into the pond. And it causes this massive ripple effect in terms of all of the adjustments that we then have to make. They're unexpected, they're unplanned, they involve more than just ourselves. Oftentimes when this happens, what we see manifest in folks is having some type of an adjustment disorder. And this can be with depressive kind of features, this can be with anxiety, or the person could just have a whole lot of just abnormal responses that they typically have never had to anything else in their life. And that is all attributed back to this one stressor here, okay? Depression. This is incredibly common when we're talking about the diagnosis of cancer, right? Because automatically the thoughts are, what? Death, right? And none of us are truly ready for that maybe in some points, maybe spiritually, but not in terms of kind of thinking about it in an unexpected doctor's office whenever you're given the diagnosis, okay? And from that point on, in times in which you're just kind of, receiving a treatment, you're not feeling well, our thoughts can go to pretty dark places. Another kind of component that happens with this is that fatigue, tiredness from our treatments from cancer, from the appointments and everything else can then limit us in engaging in some of our most loved activities, all right? That in and of itself adds another depressive factor to this too, okay? Not wanting to be a burden onto other people, getting us to our treatment, having to care for us whenever we're sick. All of these things feed into that mindset that we can see whenever somebody is depressed. And then there's this thing right here. Most of the time we think of post-traumatic stress disorder as happening to our veteran population, to our first responders, to folks who have been now survivors of any type of abuse, right? But this also happens whenever somebody can be diagnosed with a chronic medical condition, such as cancer. So cancer-related post-traumatic stress disorder, they tend to have some of the symptoms that we typically see with PTSD, but it's just not maybe as severe, all right? And it can occur at any point in time, whether it is during or after treatment, all right? And what this looks like in a patient is difficulties sleeping, right? A lot of other intrusive cancer-related thoughts that may be coming up, okay, about themselves sometimes as well as about others. It can have that kind of restlessness to it, where we just can't kind of get things started, get things going, but we have this energy that can't get displaced easily. All of that is a part of it. It's more common in reoccurring cancers, all right? So those that have a higher remission rate, we're more likely to see some of those folks have those symptoms. Typically, I work with a lot of people who are in remission, and I will usually see them maybe about twice a year. After we've kind of got some baseline coping and they're doing well and re-engaged in life again. Does anyone know whenever those times are?
Before a test.
Before a test. Before a test. I will nearly always see any of my cancer patients that I see before they're having a scan or before they're having labs done. Most of the time I won't see them afterwards until their next test, unless the results are not in their favor, which is understandable at that point in time. And that's totally fine. That's very reasonable for me to only be having to see them at those 2 points of time, because this is scary. It's stressful. Oftentimes they're not sleeping. Their belly, again, is a mess, so they're not getting adequate nutrition. Their energy levels down. Many different components contribute to this. When we are talking about some of the triggers with this, what we're looking at is certain smells, sounds, and sights that are linked to chemotherapy or other treatments. Now, in a more traditional form of like PTSD, the trigger is often a smell, a sight, or sound of whatever the activating event was. And so if, for example, I do a lot of talks with the veterans programs, and for some of those guys, trash day, is not a good day for them. I actually had a veteran once nearly wreck his car with his family in it because there was a trash bag that was sitting on the side of the road. It was trash day. In his mind and in his moment, he was not driving on the road in Ohio. He was back in Iraq, and that was an improvised explosive device. So he slammed on his brakes. Car kind of, did a nice little fishtail, and he had to take a few moments. All right? That was his sign. That was his trigger. That was visual. That took him back to that kind of place and state. Right? Even though he was in Ohio. All right? With these folks, it can just be a certain sound. And so I've worked with a cancer patient before that was sitting around having like Thanksgiving dinner, and everybody's phone or watch or iPad makes a different chirping noise to it, right? And we're only familiar with ours. Okay. Well, they heard that chirping noise, and to them that was their infusion system that was a part of their chemotherapy that was running out, and they just all of a sudden got real worried about it.
Why does it do that?
Well, whenever we have experienced, it's a learned kind of association. So all of us have them. But whenever it is connected with a fear, then anytime that connection and that emotion just kind of lash together and get very strong, and then that sometimes serves as our automatic thought or memory that gets pulled out from it. Okay? And so and it's about survival a lot of times for those folks. With smells, the reason why they serve as a big trigger for folks is because smell is actually processed in a different part of the brain than all of our other senses. And so if you smell something that smells like your grandparents' house, you're automatically transported back, oh, that's my grandfather's cherry pipe that he used to smoke or whatever, right? You weren't thinking about that before, but that smell triggered that thought and that memory and brought it right back up to the present, okay? So basically, whenever we're dealing and thinking about these things, we're having some type of activating event that is then getting strongly attached to some type of an emotion, and then those two things become paired. All right? Just as a kind of like a silly example of like a learned association, if I say peanut butter, what are most of you going to say? Okay. See my point? All right. So that's an example of a learned associate. You know what I mean? But that's the connection that happens from these things. And so those sounds serve as it. Those smells can serve as it. Again, those sights can serve as it as well. Just as another example in working with veterans, I was working with a guy that his son played baseball. And in Little League, you can use an aluminum bat. You know what it sounds like when you take a good hit off an aluminum bat? Gunfire.
He's an
Shot.
umpire.
You know what I'm talking about, right? If those kids hit that aluminum bat right there in that sweet spot, it has a big bang sound to it. That right there serves as a trigger.
Maybe I could get junk food to church.
Right. So that way we wouldn't need it, right? Hey, those things actually, aversions do sometimes work for some folks. Waiting for test results. That's another thing. Test results can never come soon enough for us whenever we are looking for them, right? Even after you send in your card, maybe with your fecal occult blood tests on there, waiting for the result of that isn't comfortable. It's not easy. Think about that with the added diagnosis of then having that condition on top of it. Changes in treatment can often serve as another significant stressor, even for other medical conditions, because anytime there's a change in treatment generally means what? It's getting worse, right? Or what we're doing isn't working. And that can send a very heartfelt message back to that patient. And so you can imagine in colorectal cancer, where we have a big subset of the population who's getting diagnosed, but oftentimes at later stages, because those symptoms are sometimes pretty silent. We may not be aware of it. Everybody thinks that we have to jump straight to a colonoscopy, so we're not doing other forms of screening, and then we jump straight into treatment. Okay? And this is oftentimes what happens with it too. So, anticipation of another scans and lab work, as we talked about, those all serve as triggers for folks who are dealing with a cancer diagnosis. Education. So how are we going to cope with all of this? The biggest thing that we can do, no matter what type of chronic medical condition we have, is educate ourselves on it, period. All right? That's one of our big goals with all of the stuff that we're doing here at HIMG, whether it be the different lunch and learns that we have, the different community-based activities that Patty does on a weekly basis, our monthly Facebook Lives. All of this is purely driven out of the need for education, because if we can be informed, we can all be, better patients maybe, right? We can learn a little bit about our condition and what we can kind of do to manage it. And truthfully, education can be calming, can be a protective factor, something that serves as a wonderful coping mechanism whenever we're dealing with something scary, all right? So we want to try to educate ourselves about the condition, the treatment, the side effects, long and short term, and any possibilities for remission that can reduce stress. All right. We want to focus on the facts. Okay. Whatever fact you are given or told is what you want to kind of hold on to. And this is incredibly important when dealing with the diagnosis of any form of cancer, colorectal being what we're talking about. With that, we can think millions of things all day long, but they're not facts. Right? I can think all day that I'm a big purple elephant, okay? But I'm not going to turn into one, okay? I can feel all day like a big purple elephant, for sure, but I'm still not going to turn into one at the end of the day. So I have to focus on my facts. And my facts, whenever it comes down to, a diagnosis of cancer, is that I know I got to go and take my treatments. I know that my treatments are focused on this. I know that if I have this surgical procedure and they're able to remove these polyps, then the risk of me developing other complications from cancer or other types of disorders is going to be reduced. Those are facts. So whenever our mind starts to wander down these other scary roads, it's always helpful to have a list of facts that we can turn back to. And it's even better if that list of facts can be specialized to our own care plan. All right. No matter what condition that you have, if you can focus that back to what your individual care plan is and the facts that are part of taking care of it, whenever it starts to become kind of scary or worrisome, reverting back to that list can be key. All right. Use this knowledge as a guide to talk with your providers and to ask questions. And so the question earlier, what is that card? What is the fecal occult blood test? How does it work? That is a perfect thing to go into your doctor and to talk with them about. Okay? Especially if you've never been assessed, if you've never had that kind of screening done. I would probably almost just, not that everybody needs to rush to their primary care provider, but see when your next appointment is with them and have a list and make sure that that's like at the top of it that you want to talk about, And going to your primary care provider, it's always good to have like 3 things that you want to know on it. You know what I mean? Or 3 things. And one of them is, maybe something that you want to know more about regarding your own condition. Like I've had diabetes for a long time. I want to know one thing about taking care of my diabetes right now that would help between now and our next appointment. I know that I'm around this age for this type of screening, for me to be assessed for colorectal cancer. Can we go ahead and do this assessment, right? So we want to know a little bit about our condition, and we might want to go in there asking, what am I due? You know what I mean? What am I due for? We do that with our cars, right? Because our cars will sometimes sit there and tell us, well, you got your, your engine lights coming on, your oil change is due, your transmission fluid. We take better care of our cars than we do our bodies.
That's true.
Right? And we pay attention to those deadlines on our cars because we don't want to pay more for a new car. Well, how much are you investing in your body? I guarantee it's about 5 times the amount of that car, right? Especially over the course of several years, especially if we're not doing preventative maintenance on our bodies. And so going in there and kind of asking that type of question is really important. And then maybe just having one other thing that you want to know or focus on, about your medications. Is there any other options for my medications? Can I get any of them cheaper? Whatever. But have those two things, one thing that you want to know about your current condition that you can maybe help to improve or do something different about, and then, hey doc, what am I due for, right? That's really, really important. It can be very helpful in guiding and making that visit much more effective for you. Family education is also key in creating an understanding and supportive environment. A lot of times, those around us, okay, they're not psychic, even though we think that they are, don't know how we're feeling, thinking, or coping with anything. And they may not be as educated on it as what we are, all right? So it's important in order to kind of convey with them what our concerns are, maybe what our worries are, but also knowledge and information, because then they can use that to help us out in those points of time. In certain conditions, it can also be helpful for us to have these discussions with our family, because many of them were probably diagnosed with it, or maybe they're at risk for it, and simply by having this kind of cohesive conversation, it can also be life-saving when we're talking about folks as well. So be sure to talk about and to share that with other people, especially your family. Coping, trigger awareness. Again, smells, sights, and sounds, okay? Those are things that we're just not going to maybe know about until they happen in that moment with it. Certain words, those can be pretty triggering too. It's time for a scan, right? We need to get your labs and check your numbers. These are all very reasonable, very normal, adequate, and appropriate things to say. However, when you've been given that diagnosis, those words convey different meaning. And it's really important that we're aware of that. Remission can serve as a trigger word sometime. Certain places, all right? We know that we avoid certain places because they may be connected to a negative memory, right? Or that we don't want to kind of go back to it for whatever reason. And so let's say that we have a patient maybe within our primary care that gets diagnosed with colorectal cancer. They get treated over in our GI department. Do you think that they want to really come back here a whole lot? Maybe not. Because this place then becomes a negative associate with maybe that word, maybe that treatment or anything else, okay? That can happen. That happens sometimes to the patients. It happens more often to the family members. Does anyone have an idea why? Because they're the support system a lot of times that may be sitting there with you or may have dropped you off for your treatments, for your infusions, for your chemotherapy, anything that might be going on. They might be the ones that are sitting there in the waiting room while you're having that kind of operation or that surgery. And that right there serves as a negative pairing for them.
A lot of people who have a history of cancer in their families, it's always, am I next?
Right. That's a good point too.
My father was one of 11 children. My mother was one of 8. They all died of some kind of cancer.
Sure.
And my only brother died 5 months ago. His brother was just diagnosed like 4 weeks ago. Really?
Yeah. Yeah. And you're right. That thought. So just as a family member and knowing your family history and having that knowledge of it, you're just sitting there waiting. When is it next?
Yeah, when's my number coming up?
Right. Right. And that's where this stuff is so important. Whenever it comes to knowing our genetic and our family risk, whenever it comes to knowing, okay, just like that car, what's my checklist? What's my checklist of screeners that we need to go down to make sure that I'm doing the best that I can to keep this motor running, kind of a thing.
What ethnic backgrounds, because I've heard this, are most common to have cancer?
Well, it depends on sometimes the type of cancer, actually. What we know is that in most cancers and generally in terms of disease states, that those that are like African American or Latin American are having increased rates of diagnosis of these conditions, and that whenever they're diagnosed, their condition is often worse than what it would be for atypical, white, let's say American. And the reason for this is what we're attributing to is just due to healthcare disparities. Is that oftentimes people of different ethnic backgrounds don't have a lot of access to preventative screenings, to primary care as being resources. And so when they are entering into the medical system, we're seeing, again, increased rates of diagnosis and severity of their conditions, but that may not just be solely to genetic makeup as well as environmental factors, but due to healthcare disparities.
I know
So-
in my diabetes materials, because I've been diabetic like 27 years, Native Americans, Asian American, African American, and on my dad's side is Native American. And you're more predisposed to diabetes because there's nobody else but me in my family.
Sure, sure. And I mean, they do have those little clusters. Okay, so diabetes is a different condition that we do see a whole lot of increased rates, you know what I mean, of certain conditions within it. With all of them, the best thing that we can do for ourselves, just as all of us being human beings, regardless of ethnicity, now I can't say the word, if I think about it, I can't say it, as well as sex or gender, however you look at it, is that we're all humans. And the best things that we can do for ourselves as humans is make sure that we're putting adequate nutrition, again, into our body, adequate hydration kind of into our body, and having some levels of activity with it that are outside, not just inside walls, and then doing these preventative maintenance types of things, you know, making sure that we're getting adequate screeners and scans. If we know that we're at risk for something, having those conversations with our doctor. If we know that we have a medical condition, making sure that we're doing everything that we can to stay on top of it, you know what I mean? And that's where, you know, we really focus on what's just one thing I can do today that's going to help me right now manage my health. And that's it, just one thing. But that again, just like the stressor will have that kind of ripple effect, a positive will also have that ripple effect. And that one thing can really be helpful whenever it comes to coping with any disease state, any diagnosis that we kind of are faced with. And moving on with some of this, continues to engage in activities. Medical conditions, including cancer, do not define us. They don't. Okay, I'm not defined by my medical conditions. I can choose to be imprisoned by them if I want to be, okay, but that's a choice. It doesn't define us, okay? Try to keep regular schedules and routines as much as possible. This is important for everybody. 9 times out of 10, every single patient that I see in my office, one of the biggest things that has contributed to their depression or their anxiety is the fact that they are not doing much of anything. They're not having set bedtimes, wake times, getting out of the house. They're not maintaining some type of schedule and routine. It's just all very kind of flowy. That's not good for us, okay? We have to have structure in order to grow, in order to live, in order to kind of be. And having that structure and routine is key, especially whenever we're faced with something like a diagnosis of cancer. All right. Moderation, modification, and pacing. All right. So treatments are fatiguing. Treatments may be uncomfortable. Treatments may have you down for a period of time. If you go through and have some of the polyps and things like that removed from a colon procedure, you may not be able to go out and hike for a few days. Okay. But talk with your doctor about that being an important component of your treatment plan. All right? That way they can sit there and say, okay, well, it's going to be reasonable for you to start to feel comfortable walking at this point in time. It's going to be reasonable for you to maybe hit the trails or to, you know, go fishing or do whatever it is that is important to you to do at that point in time. But have that conversation with your doctor, you know. If I'm going to be going through any type of invasive procedure, how disruptive can I expect this to be to my routine so that way I can modify what I'm doing. Maybe then I can do a little bit of it in moderation and slow down my pace so I'm not running around like my typical chicken with my head cut off kind of a thing, right? So we want to really have those 3 components as key parts of our conversation. And not to undermine those last things there. The power of being outside. I mean, thank God our weather's starting to have some like change to it, right? I mean, I'm not going to get the biggest snow of my life, I think, happened in April whenever I was a kid, right? But no, I'm not going to get too excited about that till after Mother's Day. That's whenever I know I can feel like I'm in the safe zone, right? I can put my flowers in the ground at that point. But get outside. Do something, all right? That is so therapeutic for all of us. Listening to music, okay? Again, those are natural things that just do our body good whenever we're able to attune to them. And laughter. You know, oftentimes, whenever we've been diagnosed with a cancer, whenever our family member has, whenever we're fearful about a test or some type of medical procedure, we don't know if it's okay to kind of laugh again. You know what I mean? We want to make sure everything's being taken so seriously. Laughter does not mean things are not being taken seriously. Laughter is a way to feel and to love and to enjoy life and to kind of treasure it and to bring something back to the table instead of thinking about everything being taken away. Okay? So those are some really important kind of characteristics to think about with this. Maintaining, again, all of those relationships, especially, again, whenever we're talking about going through and talking about our signs, maybe our symptoms, any of our GI upsets that we may be experiencing, they're uncomfortable to talk about, right? Not many people want to sit there and say, well, I'm having a hard time going to the bathroom. I've noticed my stools are different in color, that they are different in terms of consistency, that my stomach is just feeling very bloated and very painful, and this is a new experience for me. No one really likes to talk about these things, but it's that silence about them that has likely helped, again, to contribute to some of the things that we see with these high rates of cancer diagnosis within this population. In addition to, no one wants to have that colonoscopy, right? But this is where talking with people about it is the best way to destigmatize it, okay? So even today, if you leave here and somebody that you talk to later tonight or tomorrow night while you're at church or whatever else says, well, what did you do this week? This might be something different that they didn't know that you did. Well, I went to this presentation on colorectal cancer and I learned that I can take this little screening device and that can be really helpful in knowing what my risk is. You don't know what you might have just done there. You might have just saved somebody else's life or somebody else's along that kind of chain of things. But also you've shared with them something that, again, is typically stigmatized and not talked about. And the more that we talk about these things, the more people are aware of it and the more lives that can be saved from it. So share these types of things with your family, with your friends. If you are, or if your family members are going through treatment, it is helpful to talk to other people who are going through the same thing that you are. It just is, okay? Talking to others who are in remission. Use of social media. This can be a blessing and a curse depending upon what kind of support group site that you link yourself to. But generally speaking, you can weave through that stuff. Just pay attention to the positive is what I tend to tell people. Faith, you know, this is one thing that a lot of people tend to hold on to, especially during times of trial. That can be very helpful. Looking at the community as a whole. I mean, right now we have, I don't know, I'm not very good at estimating, we have 20-some people in here that are here just to talk about the colon, right? And about colon cancer. That's significant. That shows that we have a community that's interested in knowing about this. It's interested in learning about it. And so we want to keep that in mind. So again, talking about these types of experiences as a whole is great. Pets as a form of coping and support. This is one thing I can write a prescription for a therapy dog, and it doesn't take much for me to do it. I truly believe in the power of pets and animals. If you see them in a lot of cancer centers, they do have a lot of therapeutic animals that are there. A dog is the only thing that will ever love you unconditionally, right? So, but no, in all seriousness, that can be a wonderful way to kind of laugh, to smile, to joke, and to kind of cope with whatever it is that we might be going through, especially when it comes to cancer. Before I break out into some questions about this, I do want to kind of make a note to this, is that all of the resources that are on our PowerPoint slides and the ones that I kind of discussed within here, I am very selective in the information that I use to do these presentations and that I include within the handouts. And it's based upon evidence, what the research shows, what we know about these conditions, but also what's easy to understand. Because if I was up here sitting out about of stats and research stuff, It wouldn't be as applicable to what we're trying to reach here. And so if you're interested in learning more about colorectal cancer in particular, there are many effective and great websites that are included in your handouts that I would highly encourage you to go to. The National Cancer Institute is a wonderful resource whenever it comes to this. Much of what we talked about whenever we were discussing like the diagnosis and the PTSD that can come from this, all comes from that website focusing on colorectal cancer. And so please utilize these resources. Know that they are ones that are easy to read, understand, and that have great shareability, so that way you could print off something, hey, I found this and this sounds like it's good. Easy to copy links, whatever else, so that way it's not so academically focused. It's much more applicable to everybody instead of just, you know, clinicians or anything else. So any questions that folks have about anything we've talked about? Get screened, right?
Other than going to the doctor and having it diagnosed, what should be the symptoms one should be looking for?
It's very general. Any changes that you're noticing within your bowel movements, essentially. And again, this is not something that we like talking about a whole lot because there's this stigma about it. But, no pun intended, right? What we want to think about with all of this is that if we're noticing any change within our digestive system, within our output, again, in terms of color, consistency, size, yeah. I'm trying to think of an easier way to say structure. Size worked. Thanks, Beth. We want to note those things, right? And we want to talk with them about our doctor, all right? Especially if our health routine stays pretty regular, right? If we're eating the basic same things every day, if we're, you know, doing the same amount of activity, this, that, and the other, if we know that certain foods, whenever we eat them, are going to already make us sick, that may not be something to necessarily kind of go to the doctor about. For example, in addition to type 1 diabetes, I have celiac, so I can't have anything that has any wheat to it. So I know that if I have, I don't know, a piece of pizza that's not gluten-free, I'm going to be having some really bad GI effects for about a week. For me, that's not a sign of necessarily colon cancer. That's homegirl didn't eat the right foods for her belly, right? But if I had been following through with my regular diet, my exercise plan and everything, and then I noticed again, change in frequency, color, consistency, and size, then it's time to make a doctor's appointment.
And stomachache?
Yeah, some people can have pretty severe stomach ache and bloating, but those other symptoms are often accommodated, you know, go along with it too. So, but those are the 4 kind of big pillars to think about. But absolutely, you know, any change within our body warrants a call to our physician to be like, hey, I've noticed that this is irregular for me. It may be fine for Joe over here, but this is not how my body processes food or eliminates it. And so I really feel like I need to kind of get this checked and screened. And again, for colorectal cancer, that is the biggest thing that we can do, is get those screenings done. 60% of cancers is preventable. Of the second leading cause of cancer from doing this. Yeah?
They found mine through blood work.
Mm-hmm.
I was almost anemic, okay?
Mm-hmm.
And that wasn't me.
Right.
And then we did the stool test,
Mm-hmm.
stool card. It was in every, and then I had the colonoscopy.
Mm-hmm. Mm-hmm.
And that, my cancer was, I'm a 24-year survivor of colon cancer.
There you go.
No recurrences.
Isn't that amazing? But it was because you noticed those changes within your body. Your body was saying, hey, I'm not normal.
Tired.
Mm-hmm.
Why am
Mm-hmm.
I tired? So he ran a blood test, and that's
Mhm.
what he found.
Mm-hmm.
We did all kinds of other tests before we got down to that one,
Mm-hmm.
because I was losing blood.
Mm-hmm. That's amazing. And so the card test then led to the diagnosis, that led to the colonoscopy, removal, treatment.
And
Wow.
I will say that when Dr. Cunningham came in and told me,
Mm-hmm.
from the colonoscopy, do you have cancer? I
Mhm.
started crying.
Mm-hmm.
You know, I just broke down. He went out and told my husband, he came in, they left us alone for a good while, we cried together. When we left, this is when y'all were on 20th Street. We left there. My husband said, where do you wanna go? And I said, I wanna go see the pastor first. Because inside me, I was starting to be determined
Wow.
I was gonna beat it.
Already.
I knew that I had to have more help than just me.
Sure.
So, yeah, it was,
Well, that's amazing.
yeah.
Thank you so much for sharing that. In 24 years, you say? That's great.
The surgery was Valentine's Day 24 years ago.
Wow. Valentine's Day?
24 years. I said it was
Learn to
my granddaughter's
associate,
day.
right? There we go. Not a great day.
How
But
often do you involve nutritionists and dietitians?
in what?
Well, fiber?
My personal opinion is that I just have this fundamental belief that as humans, we just, especially nowadays, we don't know how to eat.
Well, that's the reason I was asking.
Yeah, we back in the day we used to because we just had farms to eat off of.
And we,
Right.
but now, when you go to a restaurant, you don't know what's in there.
Truth, and that's why I'm a huge fan of. I just believe as a regular health check, everybody should have access to a registered dietitian. Just because that individual can sit down with you and talk about your specific body, your medical conditions, what's best going to be for you.
Have you tried to buy any or find any good bones to make some broth?
Actually, yes. I'll tell you about that afterwards. I got a good one. I got a good reference to it. Yeah. And just as a general, just some basic tips whenever it comes to nutrition, because we always focus on this in our talks, again, because what we put into our body dictates how well our mind works, how well our emotions are, how well our body responds to medical conditions and treatment, is that we really want to kind of re-adopt. I mean, I know it's a fad now, but that whole farm to table concept, truthfully. You know, if you can get to a farmer's market, the one that we have here on Wednesdays, come to it. Try to just shop that perimeter of the grocery store, making sure that your diet, as we talked about kind of with the colon, that we're not consuming a whole lot of calories, that we're having moderation in terms of carbohydrates, but that our plate has a lot of healthy and nutritious vegetables on it, right? Even those old school vegetables that people don't eat anymore, like Brussels sprouts, kale, spinach, you know what I mean? Get some of those squashes and zucchinis back out and start playing with them again. Those are the types of things that we really want to try to incorporate more within our plate, as well as healthy proteins. And, you know, making sure that whatever we put into our body, we can say and pronounce, I think is important. So reading some labels is just some basics. Thinking too that, and my good friend who's a registered dietitian will say this, okay, does a fish have sticks? No, why are we eating fish sticks? You know?
Is a fish square?
Right, is it square? No. I mean, right. No, and I'm picking on fish sticks, but I mean, I don't know. Does a chicken have nuggets? No. And so those are the types of things that we want to think about whenever it comes to our nutrition.
Well, good credit to GMO, the salmon now.
Right. So we want our food to be as close to the source as possible, just as kind of an answer to your question there. And that follows through with what we're talking about when it goes to good colon health. But again, it's part food, right? It's part hydration, stress management, and then us doing those preventative checks, just like how we treat our car, treat your body. So.
One of the things they told me during the recovery part, didn't have a dietitian, okay?
Yeah.
It was just Dr. Cunningham. We kind of went over what, I was a big sweet eater. Was not diabetic at the time. He said, cancer feeds on sugar. You need to cut it way, way down. And I did. And I have ever since. And I eventually have gotten the top down to maybe 2, no more than 3 a week.
That's very good. That's
And
wonderful.
I could have drank 16 ounces every day.
Sure. So,
And I am diabetic now, but at that time.
right.
But that was what he told me, and like I said, 24 years ago, I don't think that's changed.
Sure, sure. Well, and great information to have with this. Again, check out our Facebook Live. It'll be airing live next Monday, the 18th at 9 a.m. In April, it's always the second Tuesdays is whenever I do these presentations. And I think next month we're going to focus on healthy eating, stress eating, emotional eating, all of that kind of stuff. I would love it if this place was filled up with people. So invite whoever, share it on Facebook so that way we can get some folks in here. But that's going to be our main focus and topic next month too, right? All right. Thank you all so much for being here. I appreciate it. Take care.